Nclex pediatric heart conditions you need to know. Okay, coarctation of the aorta. The memory trick here is coarctation, think cut off aorta. You can see here we have a normal open one, but with coarctation, we have a cut off or narrowed aorta. An easy way to remember all the signs and symptoms of this disease is to think that above the constriction, the pressure is going to be high because the blood is stuck above the narrowing. But below the constriction, the pressure is going to be low because no blood flow is able to reach there, again, due to the cut off aorta. Then we have tetralogy of Fallot. There is so much happening in this disease, you really need this memory trick to remember it all. So you need to prove that they have tetralogy of Fallot. The 4 things that prove you have it are pulmonic stenosis, right ventricular hypertrophy, an overriding aorta, and ventricular septal defect. Those are the 4 things that the person needs to prove that they have tetralogy of Fallot. All right, next is patent ductus arteriosus. If you go back to the fetal circulation in utero, you'll remember that there's 3 shunts of fetal circulation. We have something called the ductus arteriosus. Now, this is a hole which shunts blood from the pulmonary artery into the aorta. So in this condition, we have a ductus arteriosus, which is normal in utero, but in this condition, the hole stays open after delivery. Patent, think open. So patent ductus arteriosus is when that hole doesn't close after delivery. And lastly, we have ASD versus VSD. The patho is literally in the name. We have atrial septal defect, which is a defect in the atrium or the top chambers of the heart. And ventricle septal defect is a defect of, you guessed it, the ventricles, which is the bottom chamber of the heart. Both defects involve a hole between chambers where a hole is not supposed to be after delivery. You can find these pediatric flashcards and other nursing school flashcards on my shop, Nurse in the Making. Happy studying, future nurses.